Hey everybody, welcome to video number 2 of the Healing at Home and Trying to Not Be Bored video series. So today what I decided to do was an ophthalmology specialties ranking list. So I'm just going to give my opinions on what I think about the different subspecialties within ophthalmology, and basically, like, if you were to choose fellowship, or if I had to choose again, if I could turn back time, what do I think would be the best choice and what would be the worst choice? So with this list, I think I want to start with glaucoma, because that's what I do. First of all, glaucoma is sweet. I like what I do a lot, and it's enjoyable because, one, the surgeries are fun to do, and two, glaucoma is relatively like a straightforward condition. Also, doing glaucoma fellowship, it just prepares you, gives you a set of tools to treat everyday things that you see. You're not too worried about seeing high pressures. You're a little bit more familiar working with like conj and sclera and anterior segment related things. So in that sense, glaucoma, I like it. I would definitely recommend. It's also a little bit easier to get into than retina or oculoplastics, for example. I mean, they even let me in, so clearly it's a good option. Downsides, I would say it's kind of funny to think about the fact that you spend your entire career, your entire life treating one single condition, but hey, that condition's pretty important. And two, just like everybody says, the post-ops are kind of miserable sometimes. You may do like a pristine surgery, but there are times where the surgery outcome is just not what you expect, and you can't do anything about it, and you just have to monitor a patient and kind of manipulate it and try to baby it till the patient's healed. So I would say glaucoma, it's almost sick, but it's definitely at least in the top of the still good category. Next is general ophthalmology. General ophthalmology is definitely sick. Comprehensive ophthalmology is the best because your primary surgery is cataract surgery, which is by far the best surgery in ophthalmology. People are super happy, it's super rewarding, and on top of that you do, blepharoplasty or pterygium surgery, both of which are pretty low stress, low risk surgeries. And in the end, if you do run into any sort of trouble, there's a lot of subspecialists that can help get your back and get you out of trouble. So comprehensive ophthalmology, high reward, low stress, definitely no doubt in the sick category. Next is maybe cornea. So cornea, I like to kind of think about in two different ways. One is like academic cornea, when you think about the stuff you see in residency, right? This is like corneal transplants and perforated ulcers and stuff like that, and all the burn injuries where you have to do the anterior surface reconstructions. That stuff is super respectable. I definitely couldn't do it, but I would also never want to do it. It is terrible, I think. It's very frustrating. It's difficult surgery. I would say I would only do academic cornea if it's with a gun to my head, probably. And speaking of like contact lens related ulcers, just like to question other people or colleagues and friends. What's the longest you've ever left a contact lens in your eye if you do wear contacts? Like for me, I only started wearing contacts since I got into ophthalmology, so I'm really good, and I promise you, I've never slept in my contacts even for a nap, ever. On the other hand, I have this friend of mine who says that he doesn't remember the last time he took off his contact lenses. He said it's probably in the 3 to 6 months range, and he wears contact lenses obviously every day, but he tells me that in his entire life, he's actually never bought contact lenses because whatever samples his optometrist gives him, it lasts him for like 2 years. So just don't do that if you are not in ophthalmology. Kind of going back to this ranking list, the other side of cornea is the LASIK cornea. And LASIK cornea is like, to me, is like you did a cornea fellowship, but you pretty much don't do hardcore cornea, and you just do comprehensive plus some refractive surgery, LASIK, etc. And this is basically as good as comprehensive ophthalmology. I mean, the downside is, yes, you train an extra year, but you also get to do LASIK, which is this also super rewarding surgery. Everyone is ecstatic after getting LASIK. So I would definitely put it really high. Do I love doing LASIK? No, but all you do is push on a foot pedal for like a few seconds and then you get paid thousands of dollars. Seems like a pretty sweet gig. Let's talk about retina. So retina, also two separate fields within retina, right? There's surgical retina and then there's medical retina. Surgical retina is sweet in the sense that it's like the quintessential ophthalmologist, I think. Like the one that can take care of every single issue. So you drop a lens, your IOL dislocates, vitreous hemorrhage, retinal detachment, you gotta go to the retina specialist. And surgical retina gives you all the tools to deal with that stuff. Retina specialists, I definitely respect them, and now, coming from personal experience as well, very respectable. I think it's almost as fun as glaucoma, but it's just an extra year of training, so I'm going to say not as good as glaucoma, but still good. Medical retina, on the other hand, I don't think as highly of, because it's like the same as doing retina, but you don't have those tools. You're kind of handcuffed in terms of not being able to take care of the surgical side of things. Yeah, you do injections and lasers and whatnot, but to us, like that trained in Texas, residency is basically medical retina. I would be extremely happy if I never had to do a single injection or PRP ever again in my life. So, and to spend an extra year to do medical retina, I would definitely say it's at best I would say it's maybe. Oculoplastics. Okay, oculoplastics is sweet because it has the most variety of surgery, right? You could do your eyelid surgery, facial stuff, orbit, optic nerve surgery. But I just can't get over the fact that you spend your entire medical career at least the 4 years of residency training to do eye surgery, and then you never look at the eyeball or touch the eyeball ever again. You just end up doing plastics. It's really hard to get into. The other thing about plastics is, so you do the 4 years of ophthalmology, and then you do 2 more years of fellowship. So that's 6 years. And when I think about that, I'm like, why don't you just do plastic surgery from the get-go, right? Like you can just straight up do facelifts, tummy tucks, boobs, everything. So that's the number one downside of plastics. I think it's fun, but it's just because it's not really ophthalmology almost. Okay, pediatrics. Pediatrics, how I think of it is, it's like the hero we need but don't deserve in ophthalmology. Pediatric eye exams are like impossible, I think. Basically, I can't get through a pediatric eye exam in under 30 minutes. And like, for example, when I work every day, I work right next to this pediatric eye hallway, and it just straight up sounds like waterboarding every day. I don't know what's going on that side of things, but it sounds kind of miserable. It's like the opposite of the rewarding part of ophthalmology and cataract surgery. On top of that, I think just pediatric and strabismus is hard. It's like a hard to understand concept. Like if you truly understand what angle alpha or angle kappa, what that is, or whatever anomalous retinal correspondence, if you understand what that is, first of all, I don't believe you, and second of all, if you are smart enough, then why don't you just do like astrophysics or something? So pediatrics, yes, I definitely respect pediatric ophthalmologists, especially like pediatric glaucoma specialists and retina specialists. But for me personally, like for sure, gun to my head. It has to be like a big rifle to my head to do this. And getting on to the final bits of our list, neuro-ophthalmology. I mean, can we just agree, this sucks straight up. Like, we didn't do ophthalmology to then do neurology. If you go from the neurology pathway, yeah, I could see it's like kind of interesting. But neuro is certainly like a thing where you spend thousands of dollars and hours of time within our healthcare system diagnosing something that you end up having like no options to treat whatsoever. So I really don't. I think I would just straight up do a different specialty over neuro-ophthalmology. And uveitis, I mean, come on. This is the only thing actually worse than neuro-ophthalmology. I don't know a single person that does uveitis. And if I were to think about this, like let's say somebody has a gun to my head and was like, you have to do uveitis. I'm not going to say I'm going to let this guy shoot me, but I'm also not going to not let him shoot me. So, I mean, uveitis, it's difficult, it's complex, it's avoid at all costs. It's not why I did ophthalmology. The final thing I'll say is dermatology, anesthesiology. I mean, these two things I know are not ophthalmic subspecialties, but I had to include them because they belong right at the top of tier sick. And the reason for that is because most of us understand that ophthalmology, it's kind of a lifestyle specialty, right? Yes, we treat a lot of patients and we do work and help fix people's eyes, but overall it's a pretty low stress medical specialty. We get compensated fairly well for what we do, but let's say in cases where I have to make a big purchase, like I gotta buy a car, right? I still gotta count how much money I have. If you are a dermatologist or an anesthesiologist, this does not apply to you. Like, you cannot physically count how much cash you have because you have to weigh it. That's the only plausible option. The bang for the buck is astronomical. You do literally nothing at work and kill every other doctor in terms of your rake. So it's literally the best. I'm actually just kidding. I really love ophthalmology. I wouldn't trade it for any of these things like derm or anesthesia, no matter how jealous I am of my colleagues. It's sweet. I mean, it's definitely not, I would say it's better than retina, but it's not better than glaucoma. It's no doubt better than this junk down here, though. I mean, this stuff, it's like, don't even consider it. Anyways, thanks everybody for listening to me. I'll keep you guys updated as far as the eye goes, and we'll see you next time.